Welcome back to the Smile Effect podcast. Today I'm joined by Dr. Anna and we're going to be talking about cosmetic dentistry, specifically all things veneers. Dr. Anna, welcome.
Hi. Thank you. Thanks for having me. I'm new to this podcast kind of style interview, so looking forward to it.
It's very exciting. Now, before we get into it, what has made you smile in the last week?
So recently I went away for Christmas to New York City. It was about a 2 to 3 week holiday, so it was quite long, so I didn't get to see my dog for the time. So when I came back this week and I saw her, that was probably the thing that made me smile the most this week.
Awesome. Bring it together as a family.
Yes. What about you? What has made you smile this week?
Very much family sort of stuff as well, because the kids are on school holidays, so I've been having lots of time with them. So it's been lots of fun.
Before they go back to school?
Yes, yeah. So before we get started today, today's topic is going to be on porcelain veneers. Now this is a treatment option that isn't always suitable for everyone. So when you are considering these kind of options, it's worthwhile going to your dental professional, getting a checkup, making sure that it's a suitable option for you. Risks for porcelain veneers and considerations that you might need to take are on the website. So let's get started. Dr. Anna, one of the questions that we often get asked is, do veneers damage your teeth?
That's a really good question. I get asked that question a lot. When it comes to doing porcelain veneers or composite veneers, you may have heard that some shaving of the natural tooth structure is required. Now, I just want to get into why it's required first, and then that will lead to the answer of, do veneers damage your teeth? Okay, so the reason why we need to shave teeth down to fit veneers on is that so they don't sit outwards. So you have to consider where the patient's current teeth are relative to their facial features, their smile, their lips. So if somebody has teeth that are in the correct position, let's just say mine, and let's just say that I put some veneers over the top of my existing teeth, it would sit out too forward.
Okay.
So if you fall in this category, then shaving of the teeth is absolutely essential to a natural result. Otherwise, it's going to look big and bulky. So that's the number one reason why shaving is required, to put it simply. So do porcelain veneers damage your teeth? Well, if you are shaving your tooth away to give a natural result, then yes, you are losing that tooth structure. But that being said, whenever we're doing porcelain veneers, it is our absolute aim to always go for what we call a minimum preparation, which means just taking exactly what you need so that you can get a natural result and not shaving too much as well. While shaving is absolutely necessary for a lot of cases to give a natural result, we're always keeping in mind how much tooth structure we leave behind, because the more tooth structure we can leave behind, the healthier it is in the long term. But we also have to balance that with making it look good as well, because if we're not taking enough, that's how you end up with bulkier results.
Fantastic. That's a really clear explanation. So it sounds like with veneers and considering that whole process, it's a very individualised approach.
Yes, that is correct. So this is why it's really important to visit your dental professional so that they can actually have a look at what your teeth look like in relative position to your face. We need to also discuss what your goals are as well, because what your goals are will actually influence the type of preparation work that we do. So it is very individualized to the person. So in cases where, like I explained, shaving of the teeth is required so that you don't get a bulky result, you can also have patients who have the opposite effect. So for example, their teeth may be actually quite far back and not visible enough. So in cases like that, you don't really need to shave because you've already got the room to actually build forward to give a nice result. So veneers are very case-by-case basis.
And so with the options that you're talking about with composite bonding versus porcelain, is there some cases that would be better in one or the other? Or do you find that that you can do both in each situation?
Well, it depends what the patient is looking for and what their goals are. And another important factor as well is time as well as finances. These will often influence what the patient decides to do. So, if you're looking at porcelain veneers, that's expected to last 10 to 20 years. The aesthetics are very high because it's a veneer that's made by a technician outside of the mouth, so they can spend a lot of time making it look really beautiful, add glaze on it, make it look pretty and shiny. So like a porcelain veneer behaves similar to a porcelain tile in bathroom. It's very glossy and it's pretty color stable and strong. So that's the properties of porcelain. If you're looking at composite, the composite is like a putty that we actually shape on top of the tooth. It's expected to last 3 to 5 years, and the cost is roughly around a third of porcelain. So from a price point perspective, it's a lot more affordable in that regard as well. It's really hard to, say a blanket statement of whether composite is better or porcelain is better, because I have to consider, what the patient's goals are, what time frame they want it in, and what their budget is. But just to kind of give a rough description of what each procedure entails, that's what I usually say at the consultation to all my clients.
And so before you were talking about tooth position being an important factor.
Yep.
If someone comes to you, as you said, with a beautiful smile like yourself,
Thank you.
then you're going to need to take into consideration how much you want to build up or take away in that environment.
Yes.
If you've got someone who comes to you with really crowded teeth,
Yes.
what's the approach that you would take in that situation?
Wherever I can, if the teeth are crowded, I will always recommend to do straightening first. And there are multiple reasons for this. Straightening can get the teeth in the correct position so that if you wanted to do veneers afterwards, the result is much better. When the teeth are overlapping and crowded, and if you don't want to do straightening and you go straight to veneers, you do have to shave a lot more tooth to give it the visual illusion that it's straight. And in my experience, if the teeth are moderately to severely crowded, the result is always going to look better if you spend the time to straighten it. In cases where there's some mild crowding, the patient can consider whether or not they would want to go through, a year to 2 years of orthodontic treatment, or however long it may be, because it does add extra time and cost. So it does depend on patient preference as well. But for mild crowding cases, I think it's a lot more flexible to do porcelain veneers. But if you've got moderate to severe crowding, I will always recommend straightening your teeth first.
Yeah, so it's like getting that foundation right and then building on top of that.
Yes, that's correct. It's so much easier to achieve a nice result if orthodontic treatment has been done first.
Okay, and talking about foundation,
Yes.
how important is having good oral health beforehand, or identifying those problems beforehand before embarking on something like cosmetic treatment?
Yeah, that's a good question as well. So a lot of patients, when they come into Dental Boutique for a consultation, often they'll have, the main reason why they're here. They want their smile to look beautiful. But in order for us to make it look beautiful, the health is the foundation, and it's so important to address all of that first before doing all the beautiful stuff, because the beautiful work that we're going to do over the top needs the foundation to be successful over the long term. So whenever I see patients for consultations, I will always do a health check as well, and I'll let them know if any work needs to be done prior to beginning, whether it be orthodontic treatment or veneers.
And often when people are doing this, they're looking at things like shape changes, tooth size changes, those sorts of things. What about colour changes? Where does whitening and colour come into it as well?
At what sequence that whitening comes in does depend on what treatment has been agreed on. But let's just say the treatment agreed on is porcelain veneers. Usually I would actually do the whitening at the same time as the preparation of the teeth. Sometimes I do it before the preparation, but in most cases, I tend to do the preparation and the whitening together, either in the one appointment, or if the patient is tired, they can do it the next day or the day after, or whenever is convenient for them. And the reason why I actually sequence it like this is because if you think about it logically, the teeth that need to be porcelain veneered will likely need some sort of preparation or some sort of shaving. So that outer, layer of tooth structure that needs to be removed for a natural result, even if I whiten it, I'm going to remove it anyway. So there's not too much point in whitening before the preparation. I'm not saying for all cases, but in many cases, this is how it is. Often I will do the preparation, and then I will do the whitening afterwards on all the other teeth, and then I will do a colour match afterwards. That's the sequence at which I would do the whitening.
And with someone who comes in with really heavily stained or really dark teeth around there as well, is porcelain veneers still an option for those kind of people?
So in terms of staining, it depends what the staining is due to, because there's external causes of staining and internal causes of staining. So external is like coffee, tea, food, things that you can clean off. Internal staining can be due to a health issue or a previous root canal. So it's important to figure out what the cause of the staining is so that we can factor that into the treatment of, say, porcelain veneers. You know, if the stain is an extrinsic stain, we would definitely do a clean and a whitening to, you know, lift up the colour. But if it were to be an internal stain, we would consider perhaps internal bleaching. In terms of the stains, we can work with it, but we need to figure out what type of stain it is. And the type of stain can affect the type of porcelain that we put over the top as well. Okay. So when it comes to porcelain, there's different opacities. So there's like anywhere from highly translucent to medium translucent to opaque. So in cases where the tooth is quite discoloured underneath due to an internal problem, it's often good to choose a porcelain that's a bit more on the opaque side. Okay. That's just kind of getting into it very on the surface. I guess the short answer is yes, you can manage all types of stains, and it will be up to your dentist to figure out and problem solve how we can remove that staining and hide the colour and make the teeth look beautiful at the end.
Fantastic. And someone who comes to you with, let's say, a really extensive dental history, so they've been through a lot in the past, fillings or chipped teeth, those kind of things.
Yes.
Is that still an option that's available for them with porcelain veneers?
In most cases, yes. Right. For a patient to be able to have porcelain veneers, the minimum requirement is that the teeth need to be healthy and there needs to be enough tooth structure left behind. So it is up to your dentist to analyse this and figure out if porcelain veneers is a suitable option for you.
Oh, fantastic. Yeah. Now, we've spoken about the foundations and getting that right. How important is the aftercare?
I would say the aftercare is just as important as everything you do in preparation for the procedure, the actual procedure itself, because just like with anything in life, everything needs maintenance, right? You always hear that ideally you should have a checkup and clean every 6 months. And this is just for every patient across the board, no matter the age or the condition of their teeth. It's usually always recommended to have regular checkup and cleans. And the same applies for patients who've had veneers as well. So the maintenance moving forward after the veneers is checkup and clean, brushing well, flossing well, and maintaining a good diet. So all things that we would tell every patient regardless anyway.
Fantastic. Well, for those that are watching, they can probably see that I have veneers around there, had things built up. I had worn my teeth down quite a bit before I got the veneers done.
Yes.
And these veneers have helped restore that length, so it worked really well for my situation. But long-term, grinding, that can be an issue around there as well. Is that correct?
Yes, that is correct. If the viewers have a look at Michael's teeth, his veneers are very beautiful and natural. And his veneers are actually a combination of porcelain and composite as well.
Yes, they are.
You know, this is what you can achieve with both types of veneers. Now, when it comes to grinding is really important to manage because no matter what type of work you do, if there is an external force that's constantly putting pressure on your teeth, things can wear down and break. When we're looking at dental materials these days, our technology is the best it's ever been, but with any type of material, there's always a breaking point. And if you put enough stress and enough force on anything, it can break. You know, going back to grinding, if the jaw is hyperactive and putting a lot of force, whether you're grinding during the day or grinding subconsciously at night, it can put too much pressure on not just the work that we do, but also your natural tooth structure as well. So it's absolutely vital to control the grinding with, I would say from a very minimum standpoint, some sort of a night guard.
Okay.
Yes.
Yeah.
Because if you are grinding at night and it's subconscious, you can't really stop yourself whilst you're sleeping. But at least if you have a night guard, it will protect your teeth when you are grinding subconsciously. Yes. And that's what I usually recommend across the board for all patients.
Yeah, because particularly at night, I mean, you're not aware of if you're grinding or not.
Yes.
So a lot of damage can be done at that stage.
Yes, correct.
And so with a splint or a night guard, that's going to help protect it physically. We've all heard Botox for like wrinkles, those sorts of things as well. Where does Botox fall into it when you're talking about grinding, clenching, those sorts of things?
Botox is different to a night guard in in that it's actually targeting the muscle that is responsible for the grinding, whereas a night guard is just protecting the teeth. So the effect that Botox has on the grinding muscles, the masseters and the temporalis, is that it reduces its hyperactivity. So you're not grinding as often, and the force with your grinding with is lowered. So that actually puts less stress on your teeth.
Yeah, fantastic. So from sort of to wrap everything up around there, we've got a really wonderful smile transformation approach, but might not be suitable for everyone. So it's really a tailored, customized approach.
Absolutely. That's why, I guess answering these questions, it's been actually quite tricky for me to give like a generalized response because it's so specific for every individual situation, not just from a clinical standpoint in terms of what you see with the teeth and gums, but also what the patient wants, their time frame, their budget. It's actually very hard to make a generalized blanket statement. So I've done my very best to give like the main information that I know that, most people who are looking into this procedure are looking for the answers for. But I think for a true answer, you need to have a consultation, a proper workup, photos, x-rays, discussion, analysis. Like there's a lot of back and forth as well. It's not like, oh, you come in, I want veneers, you need 10 veneers. It's not like that at all. It's what are you looking to achieve? Have you thought about what treatment you would prefer, or would you like guidance? This is how the treatment relates to your current clinical scenario. This is how the health intertwines with that. This is what we need to do in what order to give you the result you're looking for. If you have a time frame, like let's just say you have to go overseas or you're getting married, so things need to be done in a timely manner. How would we work that through so everything can be done in time for your event? So there's so many different factors, and these are all things that I go through with the patient at the consultation. So it's so important that every approach is personalized for the patient, and an in-person assessment is the best way to do that.
Fantastic. And so from that last portion there, I mean, we did spend a fair bit of the chat talking about sort of porcelain veneers and some of the pros and the cons behind everything as well. But it sounds really like it's up to the patient, and it's very patient focused around there and very patient driven as to what they need, what they want, those sorts of things.
Absolutely. When I do consultations with my patients, it always comes from a perspective of I've got all the knowledge in terms of teeth and gums and, dental aesthetics. And I'm here to help you connect the dots because obviously the patient comes in wanting to discuss a certain point, right? But they need my guidance to get there. So my job is to find a solution that is suitable for you, not only from a clinical standpoint, but, every other factor that's not clinical as well. So I'm here to guide you and to help you make a decision. If you're not sure where to start, then I will, obviously lay out all the options and tell you what I think is going to be the option that's most appropriate, most effective, and, safest, giving the nicest outcome. And then, I lay out all the pros and cons as well. So then you can make an informed decision about what you think is right for you as well. So it's not just you come to me, I make a treatment plan, and that's it. It's very, conversational. There's a lot of back and forth. So many considerations that we give respect to whenever we are treatment planning for, say a smile makeover. Yeah,
so I guess you're really the subject matter expert when it comes to the veneers and the technical side of things.
Yes.
And they're sort of the subject matter expert over their lives in that way. And
Correct.
You've got to put those two together to get the result
that is correct. Yeah, I think a lot of the time, as a dental professional, because we're so focused on teeth and gums, can be very easy to just fall into like a textbook approach for everything. But then at the end of the day, as well, there are so many, like you said, it's life. Like there are so many life factors that are important as well. Like a lot of the time, sometimes I have patients who are like, oh, I'm getting married in 2 years. What can I do to improve my smile? So, if you've got a longer period of time, then orthodontic treatment is an option, right? Because orthodontic treatment will take roughly around a year or 2 years, depending on the situation. But if I know those timeframes, I can then, recommend suitable options. But if the same patient who wants a nice outcome still, is saying I'm getting married like next week,
Yep.
then my approach would be very different. I wouldn't be recommending starting orthodontic treatment. I'd be like, okay, well, we only have 1 week. How about we consider maybe some whitening and a cleanup and like maybe a touch up here. But then, yeah, if they said 2 years, then I can be like, okay, well, we can consider straightening the teeth. After straightening the teeth, if you wanted to do veneers, you can do it here. This is the time frame. This is how it works in relation to the timing of your wedding. You know, what's your budget? Obviously, weddings are expensive, so I always take that into factor as well.
Absolutely.
I always say, you know, like I'm sure you probably got bills for like the venue and, you know, the flowers and the dress and, you know, the suit and everything in between. So like, what do you want to allocate towards this? So then I can use all that information and start to think of solutions. You know, if they say there is no budget, then, you know, then that's easy. But a lot of the time we are working within a certain budget. So I go, okay, well, this treatment is this much, this part is this much. What do you think? So a lot of back and forth and a lot of discussion. Yeah.
And time sounds like it's a pretty important factor
Yes.
around there as well. Not only sort of how often they want to come in for appointments, but how
Yes.
much lead up time
Yes.
towards, say, an event or something
That's
around
right.
there as well. So the longer that they can give you,
Yes.
is that keep the options open?
Absolutely. Because a lot of the time, you know, if we're talking about other procedures, not just, you know, porcelain and composite veneers, but let's just say implant surgery, like soft tissue surgery, that takes a lot of time to heal and everything. There's no way to make it faster. If I have more time, it actually opens up more options and it allows me to treatment plan in a more creative way for you. So, yeah, time definitely helps. But you know, don't worry about that. Just tell us what your situation is and we'll problem solve for you.
Yeah.
So I guess the overall idea is that as a clinician, I'm always problem solving. The patient will come to me with their concern and my job is to think of different ways that we can, you know, resolve the problem in a way that's suitable with their life, their timing, you know, even like patient's location to the clinic. That's an important factor too, because, you know, patients who live far away can't always come in like very easily. So we have to treatment plan around that as well. So many factors I have to think of.
It's a very important thing because we get patients from far and wide.
Yeah, that's right.
Around there as well. So lots of people travel hours to
Yes.
get here. And it's not something that you want to just be popping down for an occasional kind of visit. You want to try to maximise their time because it's very valuable for them.
It's my job to figure out the best timing so that we can get as much done every session you come in as possible. So, yeah, so many factors other than just clinical factors to make the patient experience as easy as possible and, you know, to get the outcome in the most cost-effective and time-effective way as well.
And so from a patient perspective, when someone's coming to a consult
Yes.
with you
Yes.
and they're thinking about what they want, what kind of information is it really helpful for them to give you in order to make that kind of creative treatment plan?
You know, I think as a patient, you don't be too stressed about, you know, preparing for your appointment. That's
It's not,
my
not
job.
an interview in that sense, yeah.
Yeah, exactly. It's my job to figure out what we need to do for you to help you. But in terms of things that, you know, would be helpful is having a clear vision of like kind of what you want. Some patients are not sure. They just say that, you know, my teeth are not nice. Can you help me? But,
Sure.
you know, the more specific you can be, the more tailored I can be to that as well. It's not, you know, critical that you have to be prepared before your appointment. You can just be like, I'm a bit overwhelmed, I'm a bit lost, I just need to speak to someone, and we can just start from there as well. So from my perspective, it actually doesn't bother me, but if I were to suggest something, I would say having a clear goal definitely helps.
Fantastic. So come prepared ideally with a bit of an idea about where you want to go, but don't stress too much about
Exactly.
all the little bits and pieces. That's what you're there for, to help them get there.
Yes, that's correct. So when you come, my goal is always to take the stress off you and let me figure out how to resolve the problem for you.
Fantastic.
Yep.
Sounds like we need that in our lives.
You know, I guess we've been talking a lot about, you know, different questions, and like I said, I'm sorry I can't give like a one fits all answer a lot of the time, but I think the main take home message is that if you come for a consultation, we'll be able to tailor a treatment plan for you, and we can problem solve so that we can get you to the goal that you want to be at, but have it be suitable with your life. So your timing, distance traveling, financial factors, that's what we aim to do for every patient who walks through the door.
Great, yeah, how it fits in with their lives.
Yes, correct. Because it's not just about the teeth, it's about the person overall as well.
And so, in summary, it's a very individualised approach that
Yes.
we need to look at. It's very tailored to an individual's needs and what they want, their life situation around
Correct.
there as well. And the most important thing is to just come in, have a chat with the dentist, talk them through those kind of things, and we'll talk you through what the options are, the pros and cons, get everything together for you. And
Yes.
that way you can make a really informed choice and help steer us in the right direction as well.
Yes, that's correct. So then whatever the patient decides, once we agree that it's an appropriate treatment plan, we can get started and you let us worry about the timing and all of the clinical side of things, because that's what we trained all these years for.
That's it for today's episode. We spoke about porcelain veneers. It's very general sort of advice that we can give because it's a very specific and very tailored solution for you. So if you're interested in those kind of options and seeing whether it is a suitable treatment option, it's worthwhile coming in, checking it out, talking us through what your goals are, and we'll help you get there. We'll see you next time.